Welcome back. Mondays are for moms on 6 News at 5:30, and tonight we're focusing on a condition in infants that can affect breastfeeding, but that more doctors tonight say might be overdiagnosed and too often treated with unnecessary surgery. We're talking about tongue tie. The American Academy of Pediatrics is the latest and largest medical society to sound an alarm about the increasing use of scissors or lasers to cut away some infants' tongue issue when breastfeeding is difficult. Tongue tie happens when an infant is born with a tight or short band of tissue that tethers the bottom of the tongue's tip to the floor of the mouth. That condition can make it hard for the infant to extend and lift their tongue to get mom's milk, and it can also be painful for the mother. The Academy's new report encourages pediatricians and other medical professionals to consider non-surgical options to address breastfeeding problems, citing a study that suggests less than half of the kids with the characteristics of tongue tie actually have difficulty breastfeeding.
There have been dentists that have gotten involved and will, with a laser, go in and get rid of that connective tissue. And they feel like they have seen good results in terms of preserving breastfeeding relationships. They do it for a lot of different reasons. The practice got to be very common without a lot of good data. And we got very concerned that this was being done really without a lot of input. In fact, in many cases, without any input of the pediatrician.
Tongue tie diagnoses have been increasing worldwide. The report recommends lactation experts, pediatricians, and surgeons and other medical professionals work with parents to evaluate possible reasons for breastfeeding challenges and make the best treatment decision.